direct my questions to Philhealth, Mr. Ledesma. In the previous sessions in the plenary, I recall that there are members of the 19th Congress of the Philippines who made privileged speeches about the delay in the payment of hospitals by Philhealth Corporation. And I went over some records. I found out that it totals to the amount of 59.6 billion. That is for the end of calendar year 2024. So, may I first confirm this amount representing the unpaid Philhealth coverage to hospitals, Mr. President?
Yes, Mr. Chair.
And can we be enlightened? Ano po ba ang dahilan? What are the stories and the reason behind this huge amount of pending claims of hospitals? This is 59.6 billion.
May I respond, Mr. Chair?
Please continue, Mr. Ledesma.
Thank you very much for your question, Mr. Chair. And we are very happy at least gives us a chance to explain our side. No? If Mr. Chair, if you may allow me to pass on the Sir Renet, our SVP for Finance, will address the query. No, before Sir Renet addresses the query, Madam Chair, I just want to highlight to this committee that the payments of claims to hospitals from a year ago have been increased by almost 30 to 40 billion pesos. No, it shows how aggressive we have been in payments, in paying the claims to hospitals. So roughly, we pay around close to 15 billion a month, no, from previously around 12 to 13 billion. But to address your question, Madam Chair, a lot of it's on the denied and RTH side. I will allow VP Renet to explain in detail.
Just for purposes of clarity, Mr. Ledesma, you made mention about 30 billion and 15 billion payment of claims. Is that correct?
What I mentioned, Mr. Chair, was our total annual payments of claims to hospitals increased by more than 30 billion from the year before.
But
aggregate, Madam Mr.
Does
Chair.
it have something to do with the pending claim totaling to 59.6 billion?
Yes, Madam Chair, if I can ask Sir Net to explain in detail.
Yes, please.
Thank you, Madam Chair.
Mr. Chair.
If I may interrupt, for the understanding of the Filipino people, ano po ba ang kahalagahan nitong ating discussion about the delay in payment of claims of hospitals? Because in reality, with all due respect to Philhealth, marami po akong naririnig na stories of hospitals who have suspended or even stopped certain hospital services. For some, they fully closed. And I even heard stories about employees, health workers, who were dismissed because of issues of delay in the payment of claims. So, I am apprehensive that our intended healthcare system for the Filipino people might be affected already because of this delay, considering the alarming amount of 59.6 billion. Of course, we acknowledge na nakasandal din po, umaasa din po ang ating mga hospital dito sa claims na natatanggap nila from Philhealth. And if they will be suffering from delay in the payment of claims, chances are baka ma-derail po yung services, just like what happened to other hospitals who have stopped already certain services, and for some, they even fully closed, no? So, for the viewing public, nais po nating malaman ano ang kaugnayan nitong 59.6 billion na pending claim with respect dito sa mga hospitals na naririnig nating tumitigil yung ibang hospital services or yung iba ay totally nagsasarado na. How true na may kaugnayan ang delay ng payment ng claim sa mga nangyayaring ganito sa ating mga hospital? Mr. Limshaco, please.
Mr. Lim Shaco, you are recognized.
Maraming salamat, Mr. Chair, and magandang umaga po sa ating lahat. To address po the question, may I request to please flash the slide, Mr. Chair?
Now, just to give an idea, Philhealth kasi sa dami pong claims, we process roughly 10,000 claims daily. Daily, no? So that number would be very good kasi at least may sense. Parang average po yan per year. So parang may sense, yan yung number of days. So that's just, I hope that explains it better, Mr. Chair. Thank you, Mr. Chair.
Mr. Limshaco, tama po
Please.
bang sabihin that your presentation pertains only to those claims which were paid already?
Mr. Chair, Honorable Luistro, tama po, these are paid already claims.
In other
Napapakita
words,
po natin.
in your presentation, hindi po kasama etong 59.6 na pending claim against Philhealth.
Yes po. Ang sunod natin na slide po, ipapakita na po namin yung anong ibig sabihin ng 59.6 billion po na binanggit nyo po na mga claims po. Sunod natin.
Can we bring back the slide, please? Can you please educate us? Paano po kayo nag-arrive dun sa 41.04? Please present the actual computation.
Yes po. Ito po, ang 41.06 po ay total aggregate claims po na na-receive po natin.
I understand, pero ano po yung mga figures na finactor in nyo to be able to arrive at 41.04?
Kinukuha po natin kung kailan ng Philhealth po na-receive yung claims, and kinukuha din po natin kung kailan po na-checkayan ang claims. So,
Can you please present to us the actual computation of that 41.04?
Mr. Chair, kung Luistro, dito po hindi namin wala kaming data na nadala po, but we can come up with that computation po.
Perhaps we can ask
Yes po.
your technical staff in the office, and before we conclude with our hearing today, Mr. Limshaco, you will be able to present to us the computation that you did to be able to come up with that 41.04. Pakibalik po yung first slide. Because only if nasusunod natin itong presentation being shared by Philhealth with respect to all hospital claims, these are acceptable. 41.04 number of days, 22.7 number of days, 43.8 number of days, 47.5 number of days, 32.4 number of days, 34 and 23, all within the 60 number of days, which is mandated under your charter, correct? Is this correct, Mr. Limshaco?
Yes, Mr. Chair.
So if
Honorable Luistro.
only this presentation is being followed really by Philhealth with respect to all claims, I don't think we will be encountering this 59.6 billion unpaid claims.
Mr. Chair.
To do with his earlier manifestation. If you are saying that those decimal numbers represent the fraction of day, then I wish to believe that they represent hour. Do you agree?
Yes po naman. Yes po kung Honorable Luistro po.
Thank you.
Maraming
Mr.
salamat.
Chair,
Yeah.
Mr. Ledesma wish to manifest something.
Thank you, Mr. Chair. Can I proceed, Mr. Chair?
Please proceed.
Yeah. Thank you.
PCO Mandy.
Mr. Chair, actually, I think one of the reasons, kasi ang gaganda ng mga questioning, no, it's all very excellent, no. But I think why maybe the committee, it's a little misleading yet, because I want to highlight the slide Sernet showed is good claims, no. And the issue, I think what we're trying to discuss, Mr. Chair, is the 59.8 billion. Marami po dyan kasi is what's called denied and RTH, no? And actually, that will be explained in our next slide, no? So, I think, ma'am, medyo, it's a little confusing because like you were saying kasi, ma'am, if with that amount of days, very good yan. Pero I want to highlight, ma'am, good claims po yon. Yung 59.8, majority of that are anyway, Sir Net will elaborate more, no? Are what's called RTH, return to hospital, and denied claims, which don't fall under good claims po. Kaya doon medyo may konting, yes po.
I understand, Mr. Ledesma. However, if our intention is to make the presentation chronological, I think you should have started your presentation with the total claims, including both the good and the bad claims. And then
We'll
you
do that, ma'am.
separate the good and the bad.
We will do that. Understood, ma'am. Thank you, Mr. Chair.
Mr. Chair, permission, Mr. Chair, that we will be showing
Yes,
our slide, Mr. Chair.
but before you proceed with your presentation, may I know, ang sinasabi po ni Congressman Luistro na 29 billion, yun po yung nabayaran natin.
Mr. Chair, the
Tama
one
ba?
mentioned 59.6.
Parang 59.8 ata, Mr. Chair.
Hindi, yung sinasabi niya yung unpaid 59
Oh, 59.6.
Tama ba? Unpaid Yung pinakikita ninyo,
59.6 billion unpaid.
So yung pinakikita po ninyo, magkakano po yun? Yung nabayaran ninyo ng 23 days, ilan po yun?
Mr. Chair, sa
29?
presentation makita po natin dito po.
Okay, sige.
Kung magkanong amount po dyan for year 2024 po.
Okay, sige, please.
Initially po, before inaayos nila po yung ating slide, that 59.6 billion, Mr. Chair, as discussed in our previous hearing, ay denied and returned to hospital claims. So, 37.1 billion are denied claims. When we say denied,
You wanted the breakdown. Bakit? It took us, when we finally looked at the table, ngayon nyo lang po linalabas. I hope you understand the frustration po, no? I mean, we can't call this insignificant. When there is kahit minor differences po, it does not inspire confidence in the data presented to this committee.
Duly noted on your comment, Mr. Chair.
Thank you very much, Mr. Chair.
Just for the information of the committee, the exact amount showed in our report is 59.6 billion and not 59.8 billion. So if the Honorable Gutierrez was able to compute the total unpaid to 60 billion, then there's a difference of like 400 million.
Mr. Chair, Honorable Luistro, tama po, as I presented kanina, I provided you with the details of that 59.6 already as presented in the previous hearing. And then our data here ay na-ready po natin for presentation composed of 2017 to 2024 po. So more or less the composition again of 59.6 ay returned to hospital and denied claims po siya. So meaning if looking into the definition of is this payable of Philhealth to the hospital, again the figure presented a while ago, the in-process claims, these are claims that we considered as talagang utang ng Philhealth, meaning these are claims received by Philhealth under process and it will be paid once it will complete the process of the claims processing and of course preparation of the check, Mr. Chair. Again, 19 billion out of that 22 billion ay coming from year 2024 and November, December claims po ito. Ang majority of this one ay November and December claims, Mr. Chair. Thank you po.
Can you please state once more which part are you acknowledging as unpaid or obligation?
Mr. Chair,
Para
Honorable-
kasing the way I heard it, you're trying to distinguish the nature of your obligation
Yes
with
po.
respect to RTH, denied, and in process. May nabanggit po ba kayo na which category do you really consider as obligation? and which you do not consider as obligation?
Before you answer that, the chair would like to recognize the Honorable Janet Garin, Vice Chairperson from the 1st District of Iloilo.
Hindi. 400.
Please respond to the query of Congresswoman Luistro.
Maraming salamat, Mr. Chair, Honorable Luistro. Again, on the part ng Philhealth, Mr. Chair, we have here the in-process claims. These are claims na received ng korporasyon and pinaprocess po siya. And that's amounting to 22 billion from year 2017 up to year 2024 po. And specifically in the year 2024 po, we have 19.9 or 20 billion na in process po. So, meaning these are claims received ng korporasyon and pinoproseso ng ating mga regional offices hanggang mababayaran po siya. So ito po yung ang payable talaga o kaya claims na talagang inaasikaso ng corporation para mababayaran, Mr. Chair. As I mentioned kanina, the RTS and the denied claims, these are claims that we returned to the hospital in the accumulation and from year 2017 hanggang sa 2024 po, Mr. Chair, Honorable Luistro. Thank you po.
Mr. Limsiaco, ito bang RTH na sinasabi mo, return to hospital, ito ba'y may prescriptive period when they are supposed to comply with the insufficient requirements?
Mr. Chair, Honorable Luistro, ang ating prescriptive period, pag hindi nila na-comply yung 60 days, batay sa existing na palisiya po natin, ay pumapatak siya kaagad as denied. Yes,
I just find it strange, no? Kasi pera na to ng hospital eh. Coverage ng Philhealth, all they need to do is to facilitate the claim and they will be able to collect. That is a collection and perhaps revenue of the hospital. What would stop them or discourage them to return the claim with complete requirements?
But I just want this honorable committee to note that we also have to deal with the other issues, especially like a very, very strict commission at COA, no? Talagang tinitignan nila yan, every little detail, or possible fraud, no? So yes, it's actually a very difficult balancing act for us because we hear all these stories of the hospitals closing and all that, but I think it might be good for the committee to note that we also have to deal with all of these other agencies, no? And ang daming, historically, PhilHealth, ang daming findings, ang daming negative. So we're also, we have to weigh everything, no? I just wanted to mention that, Mr. Chair. Thank you, Mr. Chair.
Quick interjection lang, Mr. Chair, if with the indulgence
Congressman
of...
Lee.
Well, for the information lang of the committee, Mr. Chair, I have filed the House bill giving amnesty to all this return to hospital, yung mga especially yung nabanggit ni Conggreen na maliliit, no? That's why itong House bill sana Congresswoman Green would pave the way, no? Kasi hindi lang po itong mga return to hospital, pati po yung mga denied claims because of late submission, no? I think meron din pong mga denied claim and gusto ko nga itanong later on kung magkano ba to, no, yung mga denied claims because of late submissions of documents, no? Kasi within 60 days daw kailangan i-claim, no? And useless po itong pinag-uusapang benefits lahat kung itong mga hospitals na to ay lahat po, no, ayaw po serve sa mga PhilHealth members, no? So, yun lang po, Mr. Chair, no? I just would like to give the information to the committee na meron po akong final na ganung House bill, no, giving amnesty to these denied claims because of late submissions and return to hospital because of ito pong mga maliliit na mga discrepancies. Thank you, Mr. Chair.
Itinulong sa hospital to facilitate this RTH and in order to give what is due to the hospitals who have rendered the services already to the patients.
Mr. Chair.
Yes, PCEO Mandy.
I will reply, Mr. Chair, and then if I can allow COO Eli Santos to continue answering the query. Ma'am, we hear you loud and clear. What we are doing is we are encouraging, strongly encouraging, actually doing it, face-to-face reconciliation with the different hospitals and doctors. We are doing capacity building also. Kasi what we've found out historically after we have these face-to-face reconciliations, palaging very successful. Something good always comes out of the meeting. But aside from that, ma'am, to address your query, can I ask CEO to elaborate on the other measures we are taking to address this?
Yes, Attorney Dino Santos.
Mr. Chairperson, Honorable Representative Luistro, in line with the recommendation earlier of Honorable Representative Garin, Philhealth is also improving its system. So this system, Mr. Chairperson, Honorable Representative Luistro, involves front-end evaluation, meaning the evaluation, the filtering itself is done in the front end. What we are doing right now, the practice
You mean
is-
in the hospital?
Yes, Mr. Chairperson, meaning when Philhealth fully implements that system, the evaluation now is front end. So in that case, all claims that enters Philhealth will only be good claims, ready for processing and for payment.
And if that happens, there will be no more RTH.
That's correct, Mr.
Because no
Chairperson.
claim will be reaching the Philhealth if the claim is not compliant with the requirements.
That's correct, Mr. Chairperson.
But I
Honorable
wish to
Representative-
hear also, anong pong assistance ang binibigay nyo sa hospital, sa patient, to avoid non-submission or non-referral of claims to Philhealth? Kasi yung statement natin na no claims will be reaching the Philhealth unless they are complete, compliant, medyo disadvantageous po yun sa part ng patient, sa part ng hospital, na baka kaya compliant lahat ng nakakarating sa inyo is because walang assistance naman na nare-receive ang patient at ang hospital to make their claims compliant.
Before I recognize you, the Chair would like to recognize the Honorable Robert Ace Barbers from the 2nd District of Surigao del Norte. Please continue, Attorney Santos.
Mr. Chairperson, Honorable Representative Luistro, at present, we have, in addition to the strategies mentioned by our beloved President and CEO, Sir Manny Ledesma, we also implement this program called Reach Out. So, Mr. Chairperson, Honorable Representative Luistro, we monitor the level of RTH and denied claims of each facility so that when it reaches a level above 3% or even 2%, Mr. Chairperson, we immediately contact the provider or the facility and inform them of that situation. So we reconcile data and immediately implement measures to prevent these from happening again. So we coordinate closely with the providers so that they will correct their practices, Mr. Chairperson. Probably what they need is more orientation, more training, more education on how to prepare and process claims from their end. So that again, the submitted claims will improve, Mr. Chairperson, Honorable Representative Luistro.
And if I may add, Attorney Santos, I hope we can provide also a Philhealth focal person, hospital-based, who can actually and physically assist both the hospital and the patient in accomplishing all your requirements. And for my second point, I hope there are still chances to simplify the requirements in the process. Kasi kamukha po nung sinabi kanina ni Honorable Garin, if the patient is not so educated, it might be very difficult for him or for her filling in all those forms. But if we can simplify them, kung tawagin ng iba, user-friendly ang form, madaling unawain, I think we will be able to avoid itong mga RTH or non-submission of claims. And for my last point, Philhealth, kanina po may nabanggit kayo, out of the total number of RTH, a significant number were never returned anymore to Philhealth. May I know the percentage?
Mr. Chair, can I address the question?
Yes, Sir Mandy.
Thank you. Thank you, Mr. Chair. Ma'am, before Sir Renet gives you the figure, no, I just wanted to add to your earlier query. We have what's called Philhealth Cares. So we have a number of personnel that are nationwide of more than 500 people.
Are they hospital-based?
Who are here to assist all of those in the hospitals, to walk them through and to help them on anything and everything.
Hospital-based po ba sila?
Hospital-based po. And we are planning to, marami na po yan, more than 500, pero i-expand pa namin yan because we understand po the importance of...
Does it include private hospitals?
Yes po, yes po. Kasama pong private hospitals po.
I hope you can provide to all, average to big,
Yes po.
both private and government hospitals.
Yes po, we realize the importance po. And like I said, although we currently have more than 500, we will expand it even more
And
po.
I hope you can come up also with the necessary remedy with respect to small hospitals if the number of your field personnel are not sufficient anymore to cater the same service to small hospitals, especially in the provinces.
Yes po.